February 21st is Know Your Breast Density Day. So let's talk a little bit about what it is and how to find your breast density. People who have dense breasts have more glandular tissue and less fatty tissue. And the challenge is that it can make it harder to read that mammogram. There could be something that's not visualized because of the dense breasts. And that's why we recommend consideration of supplemental screening with ultrasound or MRI, depending on your other risk factors for breast cancer. 50% of the population, so 50% of women have dense breasts. There are 4 categories. Category A is almost entirely fatty, about 10%. Category B, scattered areas of density, about 40%. So A and B, you do not have dense breasts. C, heterogeneously dense, about 40%. Category D, extremely dense, 10%. C and D, you do have dense breasts. How do you find your breast density? This is not something that you can feel, that your doctor can feel on a breast exam. So often people say, oh, I must have dense breasts. The only way to know if you have dense breasts or not is on a mammogram report. So if you have not had ever, if you're young and you've not had a mammogram, you have no idea if you're dense or if your breasts are dense or not. So you get that mammogram, and it's important to know that breast density can change over time. As women age, the breasts do get less dense and more fatty. So you always want to make sure that with each mammogram report, you're looking at that. Each state has different reporting regulations on how breast density is reported, but it's going to be in the report. And if it's not there, you need to ask for it. Some will say you have dense breasts, and this is, the category. Some will just put the category there. Some New Jersey state regulations is that each mammogram has to have a paragraph that says you may have dense breasts, and then you have to go look in the mammogram report to see if you do, which can be confusing for people. So we're going to know if you have dense breasts on your mammogram report. So then what do you do with that information? Well, so I already told you that dense breasts can make it hard to see certain things on a mammogram. Now, that doesn't mean we don't do the mammogram, but we think about supplemental imaging with ultrasound or MRI. Dense breasts alone can increase your breast cancer risk, and then we're going to take that into account with any other breast cancer risk factors to determine if there's, again, what we should be doing for supplemental imaging. The biggest issue, to be honest, is with insurance reimbursement, and this is where patients get stuck in the middle. A lot of insurance companies will not pay for supplemental imaging, in part because the professional societies that issue these guidelines, some say, yes, do supplemental imaging. Others say there's not enough data to consider it, or they could be false positives. And so because it's very vague and there aren't clear guidelines, insurance companies kind of say, nope, we're not going to pay for it. And the patient gets stuck in the middle. This is all regulated on the state level, and there is a lot of advocacy work ongoing to get supplemental imaging for dense breasts covered, but it's a process and it's a long road. I do hope things will change. I think it is unfair to tell women mammography may not be as effective if you have dense breasts because we may be missing something small, but we won't cover additional testing to help you with that. I would love to know your thoughts, your experiences. Let's talk about it.